In this video, I'm going to be talking about the different types of therapy that you can have to help you with anxiety. Hi, my name's Wahida Finley, anxiety and panic attack specialist. So let's go through some of the options. So when you go to the doctor or you first hear that you have anxiety, one of the things they do is give you some medication. So it could be something like sertraline or citalopram. And these will help you to calm down or help you feel a bit better, but they won't make it actually go away. They can be addictive, so you're not allowed to just stop it like that. You can get really ill if you just stop taking it. So it's not a permanent solution. It's just to stop you getting really, really bad anxiety. So if you are feeling worse and worse all the time, I do recommend that you have it. You know, I'm not totally against medication. It can help some people, but a lot of my clients do stop their medication with the help with their GP. Once they've had some therapy, they're able to reduce their medication completely down to zero. And most of my clients just stop their medication eventually after seeing me. Other methods that the UK NHS recommend for you is CBT. So that is cognitive behavioral therapy, where they're going to try and manage your behavior, your thoughts, your emotions, using thought processors, using distraction techniques, using breathing. So it doesn't actually make it go away. It's just managing your thoughts, your emotions, and you're always going to have to do these techniques, these tips, tricks, and techniques to make it go. It will calm it down temporarily, but tomorrow you'll get it again, and you're going to have to do these techniques again and again and again. If you stop doing the techniques, then it won't work. So it's not a permanent solution, and people start to forget they need to do it. So the other thing is, if it develops into panic attacks, by then, if you are rolling around in pain or crying or distress, it's too far gone to start doing touch something, smell something, distract yourself with thoughts and stuff. It's too late, because you're crying or you're upset or you're ready to call an ambulance because you can't breathe and you're hyperventilating. So this is why some of these methods don't actually work, because they aren't permanent. They aren't getting rid of the cause. They are just working on symptoms. Some people get sent to psychotherapy, so you might need to see a psychotherapist or psychologist, where you're going to analyze things that have happened in your life. You could see a counselor as well. So counseling is talking about your problems, talking about feelings, and sometimes it can be re-traumatizing. You know, if you're going through over and over traumatic events again and again, it's really upsetting. You're going there, re-traumatizing yourself, crying about it, going home, and you sometimes feel worse when you get home. Nothing gets resolved, and you're still experiencing panic, fear, trauma, all of that. Imagine if it was something, horrible, like a rape or death or seeing a dead body or something. It's really hard to just keep talking about it and telling the therapist again and again. So it's not something that I would recommend. The other thing is psychotherapy as well. If you've had lots of different traumas, sometimes they analyze all the things that have happened in order to help you let go of it and the feelings about it. You know, psychotherapy can be good if you've got eating disorders and things like that you need help with. Counseling is perfect if you've got grief or relationship breakup, but it's not suitable, in my opinion. It's not suitable for anxiety or panic attacks. It's not going to stop, none of those are going to stop the fear response in the brain. It's not going to calm your brain down. You are just trying to distract yourself, and you might already know why you have anxiety, and just talking about it isn't going to make it go. You could just talk to a friend about it, okay, but it's not going to make the fear and the panic go. So one of the things, my clients spend a lot of money. They go to top clinics, they go to the Cardinal Clinic, they go to the Priory. Some of my friends are psychologists in some of those clinics, so they're my colleagues. I respect them. They've all got, amazing degrees and qualifications, and they are in the top rated clinics in the UK. They are good if you're suicidal, if you've really got psychosis. These clinics are second to none if you're experiencing some of those. But even if you go to their website, their recommendation for anxiety and panic attacks is exposure therapy and CBT. So they aren't going to do anything different to the other therapy that you can see outside in private therapy. The other thing is you might see a psychologist, but the psychologist is just going to guess. They're going to talk to you and they're going to guess what they think is the problem that's causing it. And it may not be what they think it is. I've seen many clients that have seen psychologists and they aren't better. It's because they're using the conscious mind and they're trying to guess different aspects of your life to figure out why you're not better. So when I do the rapid course, the reason why I can see people, even if they've been to Cardinal, even if they've been a patient, inpatient, and stayed for 6 weeks resident at one of those clinics, sleeping in there every day and getting therapy every day, they can come back and still not be better. But when they come and see me, we're dealing with the cause of it. We're dealing with the trauma that happened, and we're releasing using methods that are getting rid of it at a brain level. So this is what rapid change is, and this is why we can get rid of it really, really quickly. Some of the clients that we see, we're using a version of EMDR, which is a rapid version of EMDR, which is accessing parts of the brain, using your eyes, thinking about certain things, your eyes moving in different patterns like this, accessing the brain and the parts of the brain that are holding onto it. In hypnosis as well, I'm actually accessing what happened with the trauma and allowing your brain to know it's over, it's safe, you're alive, you're well, letting your brain know you're not in danger. So I'm not doing relaxation, I'm not doing calming techniques or anything like that. I need to release trauma and what your brain perceives to be trauma, and then it won't happen. So we know that when you get anxiety, you could be in the shower, you could be watching a movie, and it's nothing scary is going on. And that's why a lot of my clients can't figure out. They're looking for triggers, and there are no triggers because they're just walking down the street. I had it. I kept on getting it myself in 2018, even though I was already a therapist in 2010. 2018, my dad died, and I got PTSD, I think, from seeing his body. I was expecting him to die. He had cancer, he was dying. I knew it. I was expecting it. I thought I'd be okay with it. But you're just not prepared for what you see when you see, your loved one pass away. And I think I got trauma from it because after that, my body would overheat. When you get stress chemicals in your body, cortisol, and your brain has this fear response, even if you're over it, even if it's months after it's happened, you go to work, everything is fine. I was working, everything was normal to me. I thought I'd let it go. I could just be walking down the road, going to Costa with my mom, and suddenly my body would overheat, stress, body would just heat, nervous energy, and lumps appeared all over my arms like hives. I thought, is it my washing powder? Have I got menopause? What's going on? And it kept on happening when I was in a rush or something was going on. Nothing scary, but I would just get all these lumps appear and I would get hot all over, prickly all over my body. I just didn't know what was going on. And then I think after a few months, 4 months or 5 months after he died, this kept on going on. And then I thought, I think I might have PTSD. I think I'm getting anxiety. It's not washing powder. It's not menopause. So I had some EMDR with one of my colleagues and it all went away. I didn't get it again. I didn't overheat again in that way. The lumps didn't appear. I was taking antihistamines every time these lumps appeared and then they'd go away. I was, rubbing my arms under cold water and ice cubes and things to try and calm it down. But it was literally overheating my whole body in these random episodes, and you just can't control it. So it isn't under your control. You can't manage it with breathing. Even if you're not thinking of anything scary, you don't have to be thinking of things scary to get anxiety. Sometimes it is your thoughts that create the physical body response, but some of it isn't. It's involuntary in that you're dreaming, or you could be fast asleep and your brain is whirring around and you wake up exhausted. All of that goes away when we get rid of anxiety, because if we deal with the cause of it, all the physical symptoms, the shakes, the palpitations, the nervous energy, the body overheating, the feeling of dread, the constant thoughts, all of that will disappear. You're able to sleep properly, eat properly, go wherever you want to. All of it goes away. So that's basically how we can help people really, really fast. You're not stuck with it. You don't have to have years and years of therapy. So I just need to touch on another thing about hypnotherapy. So whether it's hypnotherapy or counseling, some people could see someone for like 26, 30 weeks of therapy, and they come expecting to be like £70, £90, or whatever it is they've been paying. But if you've been with a therapist, it's going to take 30 weeks. It's going to take a few £1,000s, right? It's going to take like £3,000. And you're going to be there every week, £80, £90 or whatever. And that's how they work. It's because they've got a slow process, and they're not going to get you better in a few weeks. They're not doing rapid brain techniques. They're doing these calming and hoping that it's going to go away. And that's why you're there for 26 to 30 weeks. That's how long counseling takes. That's how long CBT are done, in weeks of 12 to 16 weeks. You could do them in a set of 12, but I've seen clients that have done 3 sets of 12 of CBT. So you're still having lots and lots of therapy. Now, I'm not that type of therapist. I do a rapid program, which is the 4 weeks of therapy, because I'm using those techniques, I'm using my expertise, and I'm giving you some homework and some home tasks to do to focus, to learn to focus, and also to reprogram and rewire positive thoughts. So some of it's done at home, some of it's done with me, but it is an overall program. So the way that I work is an overall transformation. It's not session by session. I don't do session therapy. The only session therapy that I do is for a phobia, which I do in 90 minutes, and then we go off and test it. We go drive down the road or go in a lift or whatever it is that you need. I could do it online as well. So we could do it on video chat, and off you go in your lifts, and I can be with you on the phone to do it. That's the only thing that I do as a single session. All the rest, either do my 4-week or my 6-week program, which you can find out more about. If you've watched all these videos now, there is a masterclass on my website you should be able to watch, and you can just book a call for 30 minutes, no obligation. It's not to talk about me, it's to talk about, so it's not to talk about me. The 30-minute call is to talk about you, about your symptoms and your feelings, and how I can help you, and if I can help you. It's not to talk about me. So if you are interested in working further with me, or would like to have a chat about it to see if you're suitable for this program, do book a call with me. So 30 minutes, we can have a little chat. I'm not there to sell you anything, so please make sure you've watched my 10-part series so you know all about how I work and how I think and how I help people with anxiety. Or you could have watched the 30-minute masterclass, which tells you everything you need to know, and then that gives you an informed decision if you want to work with me in the type of therapy. If I'm not the right therapist for you, or I can't help you, I will help you find someone else. I have lots of contacts, so I'll be able to help you find somebody that can help you as well. So thank you for watching. Thanks for watching my 10-part series. I look forward to speaking to you soon. Thank you.